Welcome to the Medical Maverick Show, where we search out the best of the best doctors and dentists in their chosen profession. Every week, we turn our spotlight on breakthrough medical and dental treatments that can provide you with the best possible care you can get. Thanks for stopping by, and enjoy the show.
Hello, everybody. This is Eric Batty, and I'm your host today on the Medical Maverick Show. On today's episode, we're going to continue our series on short-term orthodontics and how you can get your teeth straightened in as little as 6 months. Our guest today is in the Pittsburgh area. I have with me Dr. Dan Rairigh with Advanced Dental Solutions of Pittsburgh. Dr. Rairigh, thanks for taking the time to be on the show today.
Oh, thanks so much, Eric. I'm glad to be here.
Great. Well, let's start right off. Let's hear a little bit about yourself and what got you in the dental field.
Well, I have always had an interest in art, painting, and drawing, and I've also enjoyed the science classes. When I was in high school, I was trying to think about which college I wanted to go to and what career path I was considering, and dentistry kind of came to mind as a chance to use the science and the art together, and I went in and shadowed my dentist at the time and just thought it was just a great fit, and so I knew since my 10th grade year in high school this is what I wanted to do and kind of been plowing forward ever since.
Awesome. Well, let's before we get into the subject today, let's give us a little idea about what all your service that you do and offer there at your place.
We provide a very wide variety of services. We do your basic dental care, your fillings. We do a lot of our own endodontic or root canal treatment. We do crowns and bridges. We place our own implants. I got certified at the Midwest Implant Institute in Columbus, Ohio, which is a very extensive implant training program. We do a large number of porcelain veneers. We do Invisalign, short-term braces with six-month smiles typically, and I do Botox and Juvederm as well.
Awesome. Yeah, that's. Let's talk a little difference here between youth versus adult orthodontics. That basic all-around difference between the two. Is there much difference? Typically,
the orthodontic wires to move teeth are moved in a similar fashion. I would say that the biggest difference would be in adults, the maxilla and the mandible, or the upper and lower jaws, have completed their growth, and there will be no further growth at that time. With 6 months braces, I typically will only treat the adults, which is usually 18 or older.
Okay, so for 18 and older. Now, what options in all? You mentioned Invisalign too. What options do adults have in getting braces, and why and how can somebody actually get their teeth straightened in 6 months?
When the patient comes in for a consult, I'll look at and determine what their chief concern is. What is their goal? And oftentimes, their goal is just to correct the teeth they see when they're smiling. If they have a cross bite or a deep bite or other aspects of their occlusion that I feel would be benefited from comprehensive orthodontics at the orthodontist for 2 to 3 years, I'll actually recommend that to them. I want to be upfront with the patients and be realistic with what we can achieve. And I basically will treat my patients after they have told me, Dr. Rairigh, it's your treatment or nothing. I really have no interest at all in going through 2 to 3 years of braces. So what can you do for me? And at that time, I'll be realistic with what we can fix and what we can't. We offer Invisalign and the 6-month braces. There are pros and cons to both systems. I prefer the 6-month braces in most situations because with the brackets and wires, we're just able to have more control personally on what we're doing. With the Invisalign, it's kind of pre-done ahead of time, and teeth don't always move or track, as Invisalign calls it, predictably in some patients. So with the 6-month braces, if they come in and the tooth's not moving the way I want, I can see it after a couple months, and I can reposition the bracket or put some bends in the wires to kind of progress with the patient during their treatment.
Interesting. So how long has this, how long has your practice offered this 6 months braces, and what's the history behind it? Has it been around?
We have been practicing with the 6-month smiles protocol for this is our 5th year of treatment. And 6-month smiles is a new spin on short-term orthodontics, but short-term orthodontics has been around for a while. And what 6-month smiles has done is basically taken that and geared it more towards adults in a manner that allows them to have brackets that are clear and wires that are tooth-colored, so they don't have the railroad train track type of look with their smiles. So 6 Month Smiles has kind of taken a dental treatment that has been around and kind of streamlined it more for adults that are professional that would otherwise maybe have their work or schedules interrupted by people being more aware that they're in braces.
Right. So is there any other disadvantage with this treatment, and is there any potential damage that can be caused to the teeth in general?
Not really any damage. Again, the principles are very similar to regular orthodontics. It's just we are more focused on the anterior teeth. However, in my experience, we have been able to do a lot of work with our posterior teeth also. So a lot of times I try to be upfront with the patient. We might not be able to fix their posterior crossbite, for example, but with the use of elastics, incorporating other orthodontic techniques with the 6 Month braces, we're able to correct a lot of situations for patients and actually usually give them better results than we had anticipated originally.
That's great. So is there any factors, what kind of factors that determine the length of time an adult would need to have and be in treatment with the 6 Month brace? Is that a standard 6 months, or is it earlier or later? What's the area?
It is not a standard time. Basically, 6 months is an average. The average treatment is from about 4 months to around 9. Personally, I've had patients done in 3.5 months, and I've had patients that were in for about 10 months, which is typically a little longer, but as we're moving, there's other areas I feel that we can correct for the patient, and we kind of both agreed that to try and do that. So it's more of an average, and I'd say most of the time that's pretty accurate.
Gotcha. And is there any factors, outside factors, that may, spring up along the way that might extend that time that's necessary for treatment?
During the treatment, there are some times where teeth are just a little stubborn, and they don't want to move kind of as predictably as we'd like, so we have to try a couple different techniques to move things along. But the biggest factors that I feel personally contribute to length of time can be determined before treatment has started, and some of those are severe crowding or a deep bite or very large spaces typically tend to take the most time, and those are the patients that will be more of the 8 to 10 month range.
Gotcha. So what is a typical treatment schedule, and how often do patients actually come in and see you?
I would say most of the time it is a once a month visit to our office. There are periods of time, particularly at the end when we're closing spaces, where I'll have the patient come in every 2 to 3 weeks, because the power chain elastics we use to close spaces kind of lose some of their force after 2 to 3 weeks. So I feel by adding an extra visit a month and bringing it up to 2 visits per month can speed things along a little bit for the patient. And there's other times where I will have them come in after 2 weeks because a certain tooth that is positioned in a way that's kind of locking the other teeth from moving. I feel that a bend I put in a wire will allow that movement in 2 weeks, and that will allow me to then start the next change in their tooth movement that I want to start without making them wait a month.
Okay, that's interesting. What can your patients expect in regards to any kind of pain or discomfort during treatment?
It's very interesting. We have a lot of our patients who've gone through their children having braces, and I remind them, it's like, if our kids can go through this, we can too, but it's going to be a little bit a little uncomfortable. Primarily the discomfort's going to be their lips. The initial few weeks kind of have to tighten up a little bit and just get used to rubbing against brackets, particularly if the teeth are crowded. Some of the teeth are going to be farther forward than others, so that bracket is going to be more protruded and more of the lips going to be focused on just that one bracket. So as the teeth move, they get more balanced, and also your mucosa in your lips and cheeks kind of just get toughened up, and that usually takes a couple weeks. And also every visit when we come in, the patients will change their wire. We do a little bit of tooth slenderizing or interproximal reduction, where we very gently narrow the teeth very subtly just to allow the teeth to kind of slide past each other. When we put the new wires on, the teeth are engaging in a new movement, and typically they'll have some soreness associated with that for about 2 to 3 days. And oftentimes I'll just tell patients, when you're coming in for your next visit, why don't you go ahead and take some ibuprofen before you come in, and then for the next 2 or 3 days. And that typically takes care of it. Most of our patients, after they are usually 6 to 8 weeks in, they're kind of on cruise control. They're familiar with what's going on. Their lips are used to the treatment. They kind of know which foods to avoid right after the wires have been changed, and they get it down. And most of our patients do very, very well.
Interesting. Now, is there any other health issues, or allergies, or anything that the patient might have otherwise that could cause any problems?
The main allergy that I've encountered is a nickel allergy. And I had one patient who had treatment, and I let her know up front that the wires are made of nickel titanium, and there could be a reaction, but with 6-month smiles, they have a coating on them that make them more tooth-colored. And we treated the patient with that. That coating actually protected her from having any allergic reaction whatsoever. So that's really the only allergy that I'm aware of. I've only had one patient, and it was a non-issue.
Interesting. Good to know. Now, we're talking on Halloween today. So are there any foods that the patient should be avoiding during treatment?
Extremely sticky or extremely hard. I tease with my patients, and I tell them, if you're getting ready to take a bite of something, and if I was watching you, how would I respond?
Exactly. So what do you recommend for the care of the braces and oral health during this treatment?
I like the patients to at least brush twice a day. One would be after breakfast and after dinner before bed. But if they can have their toothbrush with them at work and do one other time after lunch, that would be fantastic, or at least get a chance to maybe rinse out to remove any debris that would be sitting under their brackets. We prefer if they would floss, but it can be very challenging to floss underneath the arch wires and the brackets. So typically I will recommend a water pick because it's so much easier for patients to clean and do that before bed. Any debris that's in there they can get out, plus they can put a little bit of Listerine in with the water pick and actually flush that up underneath there. It gives it more of a fresh kind of clean underneath the braces feeling.
Yeah, I found the water picks work great too. So what can your patients expect post-treatment? What further care is needed to maintain the straight teeth? And we also talked about how to incorporate cosmetics into the program that you do.
As far as maintaining teeth, that is a very common question. Or how do I keep my teeth straight? And I tell patients, teeth, we move them to get into the current position, and they can move back. So basically, as long as you want your teeth to remain straight, we need to have some form of retention. I typically prefer to do a dual retention process where we will have a lingual wire bonded to the inside surface of the teeth that the patient will wear throughout the whole day, and we will also make a removable, clear Invisalign-looking Essex retainer that they will wear at night over top of that to really stabilize things. And if the bonded wire would ever come off, they also have that as a backup. And as far as the other post-op treatment, a lot of our patients would come in are adults, and they have had orthodontic relapse from not having worn a retainer before. So those patients typically are very cooperative in doing that because they've already been there. They do not want to go through orthodontics a third time. Also, we have a lot of our patients, again, as I said, are adults. When children's teeth come in, as they're erupting, the orthodontist will do interceptive orthodontics and kind of guide the teeth into the correct alignment. But adults have a unique situation where their teeth often have been in malocclusion for 20 to 30 or more years. And as that alignment is in place, when they're eating, their teeth will have very unique and wear patterns and chips and fractures. And when I look at that, I'll have a series of photographs I take, and I'll show the patient different views and let them know ahead of time, when we make your teeth straight again, the alignment will be nice, but we have to understand your teeth have been functioning in a misaligned position, so you're going to have wear patterns. So when your teeth are straight, your teeth on the edges may appear chipped or crooked just due to how your teeth have been occluding. So we'll incorporate that into our treatment plan ahead of time with cosmetic bonding or veneers. And oftentimes we'll be able to, even if the patient chooses, if they're going to have to do veneers anyway, we'll do kind of a middle-of-the-road treatment where we will use the 6-month smiles to align the teeth about 90% to where they go, and then use the veneers to correct it afterwards. So that's, I think, a big benefit for adults having their short-term orthodontics treatment done by a cosmetic dentist, is that we can see the whole picture. Because a lot of patients will be disappointed if they have straight teeth, but the edges are chipped or uneven, and or they're discolored. So we look at the whole picture of a smile as a whole rather than just the straightness of the teeth.
Yeah, and that makes sense. That's awesome. Now, what about insurance and financial options? What do you have to offer for your patients?
Some of our patients do have orthodontic coverage for a one-time orthodontic coverage. I would say probably about 10% of our patients have some kind of orthodontic coverage. But if they do have it, typically the insurance will reimburse for that. We do have several financing options. We will do a third party like Care Credit or Springstone we'll use often. And we also have an in-house financing where the patient will make a deposit, and over the next 6 months, the remaining balance will be paid on as they come in every month.
Okay, well, that's great. Now, that's pretty much about what I had for you today. I want to thank you for being on the shows. If our listeners want to learn more about you and get in contact with you, how can they do that?
They could visit us on our website. It's www.pittsburghisSmiling.com, or our office phone is 412-854-2310.
All right. So if you're in the Pittsburgh area and you're looking for a dentist, Dr. Rairigh at Advanced Dental Solutions at Pittsburgh, we can help you out with all your dental needs. Okay, that's it for this episode of the Medical Maverick Show. We want to remind you to stay informed, feel better, and live healthy. Thanks, everybody.